We just need to be able to hold out just a little bit longer.
Local hospitals seeing a surge in COVID-19 patients may soon get the help they need to turn the tide on the pandemic.
Today, an advisory panel recommended that the FDA greenlight the Pfizer vaccine for use. The vote was 17-4. Our ABC 10 News reporter Anthony Pura has more on how local hospitals are now preparing their staff to get protected from the virus.
Hospitals are preparing for two things right now. On one hand, they are preparing to distribute this vaccine once they receive it, but they're also preparing their staff for a continued surge in COVID-19 patients. The Pfizer vaccine made it past a significant point Thursday. An advisory committee meeting over Zoom recommended the FDA authorize emergency use of the vaccine for Americans 16 and older.
I do not see a universe where the FDA would not approve it.
Dr. Davey Smith is the Chief of Infectious Diseases and Global Public Health at UC San Diego Health. He says once San Diego County receives the vaccine, it will first go to frontline workers and then vulnerable patients. However, the first shipment will be limited.
There probably won't be enough for all the frontline workers. So we even triage among the frontline workers. So who has the most contact in terms of like emergency room workers, nursing staff right on the front desk. Those are the people who should and will get it first.
Right now, a discussion whether it will be mandatory for staff.
We're hoping that we can have an open and fair discussion with all of our faculty and staff across UCSD to really make sure that we're protected. But it's not mandatory now, but those discussions are going on.
The county expects to get 28,275 doses of the Pfizer vaccine next week if it gets FDA approval. It is coming at a crucial time amid a growing number of COVID-19 infections and shrinking ICU capacity.
We are in the midst of a surge, so it's not we're waiting for a surge. It's this surge and then the surge upon a surge and then the surge upon a surge.
And as UC San Diego Health is preparing to receive the vaccine, it is also preparing for anything and everything.
If we hit 100% in one unit, we're going to open up something else. We have other outside facilities with tents, and we've thought through this through every single scenario, and we have people who are, not taking vacation, and we have backups upon backups upon backups to try to keep San Diego safe.
Anthony Pura, ABC 10 News.
Here are the next steps for the U.S. The FDA is expected to authorize the vaccine on an emergency basis within the next few days. Then the CDC will vote on whether to recommend the vaccine and for whom. Then the shots will start being moved out within 24 hours. States have the final say on how the vaccine is administered.